Welcome and thank you for joining us for the fourth and final installment of our Recreational Water National Webinar Series. I'm Christy Dembra, Chief Learning Officer at NEHA, and I will be your moderator. This webinar will focus on our current understanding of the environmental and public health consequences associated with exposure to freshwater Cyanobacteria Harmful Algae. I knew I was going to blow that one. Blooms, and we will provide an overview of emerging issues. We ask that you please write your questions into the chat box and we will address them at the end of the session. If you are not a NEHA member and enjoyed this session, we invite you to become one at neha.org. Our presenter today is Dr. Elizabeth D. Hilborn. Dr. Hilborn is a graduate of the University of North Carolina at Chapel Hill, where she earned a Bachelor of Science in Biology, a Master's of Public Health, and served as a fellow in the Centers for Disease Control and Prevention's Epidemic Intelligence Service. She earned her doctorate in veterinary medicine at North Carolina State University and is board certified in the American College of Veterinary Preventive Medicine. For over 25 years, Dr. Hilborn has worked as an environmental health scientist and epidemiologist at the U.S. Environmental Protection Agency's Office of Research and Development, where her research focuses on emerging infections and the health effects of environmental and waterborne contaminants. So, Dr. Hilborn, I have already completely messed up the correct pronunciation of cyano algae blooms. So, explain to us how that is pronounced, and would you go ahead and start your presentation? Thank you.
Thank you so much, Christy. I know it's a mouthful and it doesn't stop there. All the organisms, all the toxins, it's ridiculous. So you are not alone.
I practiced it all morning and I still messed it up.
It doesn't help. It doesn't help. It's only time. Let me get to sharing my screen. And I hope you can see it.
Yes, we can. Thank you.
Wonderful. Okay. And let me try advancing it. Welcome everyone to Cyanobacteria Harmful Algae, What You Need to Know. I'm Elizabeth Hilborn. I'm a staff scientist at EPA's Office of Research and Development. And I will be providing an overview today. I'm going to try to see if I can get my sharing so I can see the slides. Now we practice this too, see best laid plans. Okay, so what will I cover today? What are cyanobacteria? What is One Health? I think it's a very useful paradigm for dealing with cyanobacteria. I'll provide an overview of cyanobacteria toxins, cover some important sources of exposure to harmful cyanobacteria, and discuss the adverse health effects that we have seen associated with harmful cyanobacteria. I'd like to introduce the concept of animals as sentinels of human cyanobacteria-associated risks, and then provide a summary and some resources for you. So what are cyanobacteria? So you hear all these terms thrown around: blue-green algae, harmful algal blooms, toxic algae. What I'm showing you is the wheel of life. The green are archaean organisms, red eukaryotes, and the blue are prokaryotic organisms. And algae are actually eukaryotic. Cyanobacteria are not truly algae, but they picked up that name. They're green, they float in the water like algae. Cyanobacteria are photosynthesizing bacteria. They can occur in individual cells or in colonies. And they're ancient. They helped establish our oxygen atmosphere over 3 billion years ago, and they're essential in our ecosystems today. They're found in freshwater and marine environments, also in terrestrial environments where they perform important functions such as nitrogen fixation. Unfortunately for us, they can produce potent toxins as secondary metabolites, and these can be extremely toxic to other organisms. There's a lot of research trying to find out what is the benefit to the cyanobacteria for producing these metabolites, because they take energy and we don't know all of their functions. I have a picture of marine stromatolites here because I learned of stromatolites are some of the first fossils, the oldest organisms on Earth, and they're actually accretions of marine cyanobacteria. So you may be aware of the term cyanobacteria bloom. Blooms are accumulations of cells or colonies floating in a planktonic way, loose in the water. Pelagic means open water. They're common contaminants in these surface water systems. They require sunlight to live, and they're favored by warm, stable, nutrient-rich water. They're a nuisance for water managers. They can foul recreational beaches, and they cause taste and odor problems in drinking water. They're nutrient limited. Once they occur in a body of water, they have organelles that persist on the bottom during wintertime in the northern tier of states when growth conditions aren't favorable. They're ready there waiting. When the water warms up, when nutrients wash in, they're ready to bloom again. We are actively supporting cyanobacteria with our nutrient pollution. So I'm just going to discuss One Health briefly. If you think of the biosphere, we have an interconnected web of animals, including humans, of microbes, plants, fungi, and some of the issues we're dealing with today in the environment are not restricted to one group. They are cross-disciplinary, transdisciplinary issues. So One Health is a thought paradigm. It encourages you to step out of your specialty silo and start communicating with people from other disciplines, coordinating and collaborating to deal with some of these overarching problems that we're seeing now. Now, One Health, the concept became popularized with zoonotic disease, with diseases jumping from animals to people, or vector-borne disease, where there may be vertebral hosts that carry, say, Lyme disease or other bacterial infections, and then ticks can transmit them to humans and other animals. So I'd like to propose cyanobacteria as a One Health environmental exposure. I think the environment is underappreciated in One Health, but humans and animals share the environment. Now, we can modify our exposures with our practices and behaviors. We build shelters, we treat our water, we have food quality control, and we have knowledge and preventive practices that we put in place for ourselves and many of our owned animals. But animals, especially wildlife, may experience much higher environmental impacts and consequences: extreme temperatures, exposure to pathogens, toxins, and other environmental associated injury. Cyanotoxins. Now, I am just showing you 4 of kind of the most common groups you may hear about. Cyanobacteria are bioactive compound producing machines. These are targets of so much research for people who want to isolate compounds for therapeutic purposes. There are thousands of them. We haven't named them all. We haven't discovered them all. More compounds are discovered and characterized every year. So these are just some common groups that I'd like to go over. Anatoxins, neurotoxic alkaloids. They mimic the effects of acetylcholine. And at low doses, you can have diarrhea, vomiting, shaking, higher doses, convulsions, all the way to death. And it used to be called, before it was isolated, very fast death factor. So progression from lethal dose exposure to death is hours to minutes, depending on the dose. Cylindrospermopsin, cytotoxic alkaloids, they are non-specific cellular toxins. They affect multiple tissues. Historically, liver and kidney effects have been highlighted. Recently, neurologic effects have been identified. They inhibit protein synthesis. And cylindrospermopsin itself, the metabolites are more toxic than the parent compound. So a single dose will have greater effects over time. Microcystins are a group of liver toxins, hepatotoxic, cyclic peptides. There are over 100 congeners. They are potent protein phosphatase inhibitors. They have multiple downstream effects, but they became known as liver toxins because the liver actively takes up the toxin, and at high doses can cause hemorrhage, liver necrosis, and rapid death. Saxitoxins are neurotoxic tricyclic guanidinium alkaloids, and they are sodium channel blockers. Saxitoxins are found in freshwater and marine environments. They're made by multiple kinds of organisms. You may be aware of them. They're associated with paralytic shellfish poisoning from contaminated seafood consumption. And here's just what I mean by kind of these heterogeneous groups. Here's a recent study out of our group. Donna Hill and Neil Chernoff are toxicologists in our group, and they orally administered 5 different congeners of microcystins. These are commercially available standards, and they assessed their no observed adverse effect level and their lowest dose observed adverse effect level. And you can see they ranked them for toxicity, but also look at the differences among the effects. So these compounds really vary. There's not just one microcystin that you can say, oh, that health effect is not associated with microcystin. This is a group of toxins to really keep an open mind about. Sources of exposure include drinking water and surface water. Now, treated drinking water exposure is very rare because conventional treatment does tend to remove toxins. Utility operators are becoming more aware of which toxins may be present in their waters and are taking steps to eliminate them. But even just chlorine alone can oxidize many of these toxins down. But it's different for every group of toxins, and there's a huge body of literature on it. This is not my specialty, so I will ask you to go out and speak with water treatment specialists. Drinking water is mostly a risk where people are taking untreated drinking water and using it for bathing, cooking, drinking. And this happens with century-old lake houses where people have a straight pipe into the lake. And even if they have a filtration system and they think they're cleansing their water, if that system is not adequately designed to remove cyanobacteria toxins, and if it's not adequately maintained, it can give a false sense of security. So this is really the biggest area that I'm aware of where drinking water is a problem. Surface waters are frequently implicated in adverse effects associated with cyanobacteria blooms because people have direct exposure to them. And you know that when swimming, you can ingest water, especially children ingest more water than adults. Cyanobacterial scums themselves, dense accumulations of cells or colonies, are the highest risk exposure if the bloom is toxic. Not all cyanobacteria produces toxins. Hemodialysis treatment for renal insufficiency is a rare but serious exposure. There have been cases where drinking water was inadequately treated, then dialysate was prepared from that water, and people were exposed intravenously to cyanobacteria toxins. And that did result in severe illness and some fatalities. Aquatic foods are a potential source. We eat freshwater foods, fish and shellfish. We do know that the toxin tends to be concentrated in the liver or hepatopancreas and invertebrates. So a whole soft shell crab, freshwater mussels, where you're eating the whole animal, if it's taken from contaminated waters, it poses a potential risk. We don't know much about mussel concentrations in finfish. We do know that concentrations vary among species taken from the same body of water, and we do know that concentrations vary among different representatives of the same species. So there's active research to really characterize this so that we know when we're out fishing what's safe to eat. How do we determine that? It's a work in progress. Ambient water aerosols. We don't know the risk associated with ambient water aerosols. It's another work in progress. And we are concerned about water aerosols because we do know that when waves are crashing on the shore, when a jet ski is creating aerosols in a HAB-dominated bloom, that cyanobacteria and their toxins can be aerosolized. There are multiple studies now showing that microcystins, one of the cyanotoxins, has been isolated from people's noses with a nasal swab when they are near a HAB-dominated lake. We don't know of any health effects associated with this exposure. It's an area of active research. We also know that produce items can be contaminated if items are irrigated, say with overhead irrigation from a contaminated irrigation water. The cyanotoxins can be on the outside of the produce item, but also plants can draw up contaminated water and internalize the cyanobacteria toxins, another area that's very poorly characterized. I skipped right over supplements, but multiple blue-green algae cyanobacteria supplements are marketed. In the early 2000s, a survey showed that some of these were contaminated with microcystins. Many in the industry have quality control programs where they test for microcystins. But remember, blue-green algae can produce multiple bioactive compounds. So even though these supplements may be high in protein and antioxidants, buyer beware. I don't know what to say about these now. I think it's an emerging story. And they're also marketed not only to people, but to animals. So I've mentioned that people have been sickened by water, and recreation is probably the biggest source of exposure, rarely hemodialysis, and uncommonly drinking water. There are historical reports. There was an episode where cyanobacteria toxin broke through into finished water in Toledo, among other places. But Toledo really made the news in 2014. And here's an official showing everybody, it's okay to drink the water now. We can use it again. So these are some areas. Animals are also at risk from not only direct exposure. You can see the dog and the cattle immersed in a cyanobacteria bloom. Who knows if it's toxic, but if it is and they're drinking that water, this is a dense cyanobacteria bloom. The indirect exposure, you can see this brave wildlife official handling a blue heron. So this animal may have become intoxicated by avian botulism. These outbreaks can occur after cyanobacteria bloom starts breaking down. It consumes the oxygen You get a drop in dissolved oxygen in the water body with a fish kill. It's warm water. It's a prime setup for avian botulism outbreaks. There have been severe impacts reported on pets. We get notices now in the media of dog deaths at least every year recently. And these do make the media, and I believe they've increased awareness for people that cyanobacteria blooms are a health risk to dogs. I don't know if that translates to people, but this is a common finding now. I'd like to present to you kind of a mystery that many of us are trying to chase down. And it started after a report of an event in 1989. 18 soldiers in the UK were canoe training. They were rolling their canoes, some capsized, sure, they gulped some water. Many of these soldiers developed acute gastroenteritis, which is nausea, vomiting, diarrhea, abdominal pain. 2 were hospitalized. They were found to have elevated liver enzymes and pneumonia. And at the time, when I've been working in this field for a couple of decades, and the conventional wisdom was, oh, they must have aspirated the cyanobacteria. But now I am not sure at all that was the case. Let's fast forward to 2007, a case report of a recreational boater who was immersed in a heavy microcystis bloom. And that was the causative organism of the bloom in the UK outbreak. It was a microcystis bloom, and microcystins were isolated from that bloom within a day of these men getting exposed. So again, in 2007, microcystis bloom, a gentleman was exposed who was recreational boating, and he developed acute gastroenteritis and respiratory illness. He had to be hospitalized. He required intensive care, intubation for acute respiratory distress syndrome, and he was also found to have elevated liver enzymes. In 2011, in Kansas, there were multiple lakes impacted by microcystis-dominated harmful algal blooms. In one lake, Milford Lake, 13 cases of bloom-associated human illness were reported. 7 of these were confirmed. What does that mean? The diagnosis of harmful algal bloom-associated illness is a diagnosis of exclusion. That means the care provider, that nurse practitioner, physician, PA, did testing, tried to eliminate what could be causing these effects, came up empty-handed. Well, you were recreating in this known bloom now, maybe it was that. That would be a confirmed case, a diagnosis of exclusion. We don't have diagnostic tests for these exposures. Excuse me. So what were the effects? Rash, gastrointestinal effects, upper respiratory effects like snotting, coughing, fever, joint pain, and lower respiratory effects, pneumonia. Sounds familiar, microcystis-dominated bloom. 7 dogs became ill. Actually, after the human cases, there were 6 confirmed cases, 5 deaths. When you have a death you think is associated with a harmful algal bloom, you can take gut samples, stomach contents, have them analyzed for the toxins. Also, liver biopsies or pieces of liver in a deceased animal can be evaluated for cyanobacteria toxins, and that would be a confirmed case as well. The Centers for Disease Control and Prevention has a national outbreak reporting system. They do surveillance for many different types of outbreaks, including foodborne disease outbreaks, person to person, but waterborne disease outbreaks. I was working with them to prepare a report on the years of 2009 to 2010 recreational water associated outbreaks. Of 24 outbreaks during that 2-year period that were reported through the system, 11 were algal bloom associated. At the time, that was the largest number of algal bloom associated reports ever reported to NORS. And these all occurred in the northern tier of states in the United States. Now, all outbreaks occurred at public or private lakes and all occurred during the summer months. 61 people became ill. There were no deaths. The majority were female and young, less than 19 years of age. And the majority sought health care. They either contacted their physician, maybe went to the hospital, to the emergency room. 2 were hospitalized. And I've organized the most commonly to least commonly reported effects. So skin effects could be rash, itching, ulceration. Gastrointestinal effects I've already mentioned. Respiratory could be upper or lower respiratory, wheezing, coughing. Non-specific effects like fever, loss of appetite, malaise, ear effects, ear pain, discharge, nervous system effects. This could be changes in vision, trouble walking or ataxia. It could be numbness or tingling of extremities. Could be confusion, cognitive changes. And then the last group were muscle pain, joint or bone pain, and eye effects like irritation or discharge. The most commonly to least commonly reported toxins detected: microcystins, anatoxin A, and then saxitoxins and cylindrospermopsin, in that order. And I'm showing you of the 11 outbreaks, 8 actually evaluated toxins in the implicated water bodies. Now, the water defined the outbreak, the location defined the outbreak. And I'd like you to notice of the 4 major groups of toxins here, not everyone analyzed every group. So a bar means it was not evaluated. That toxin was not evaluated in that body of water associated with this outbreak. The ND means it was not detected. You can see that everyone looked for microcystins. You should know this could be absolutely detection bias, that microcystins were the most commonly reported. So these are the first cyanotoxin standards developed. Most of the early toxicology work used microcystins, and one of the first easy screening ELISA tests was for microcystins. So you can see that concentrations really varied among outbreaks, and these are concentrations within 1 day of the outbreak period. So again, the body of water defines the outbreak, and people may have been sickened over days or weeks at that body of water. So we put the maximum concentrations here. And I have some concentrations in red. I don't know if you can see my cursor. For cylindrospermopsin, 15 micrograms per liter, microcystins 8. These are EPA's recommended concentrations for recreational water to help develop recreational water advisories. And I dropped the link to that document in the chat. So hopefully you should be able to access that if you want to read more about this. Notice that these can occur in mixtures. I starred the outbreaks where neurologic effects were detected because this was a new finding at that time, that neurologic effects could be associated with ambient cyanobacteria exposures. And also I'd like to call your attention that there were some sentinel events. In 2 of these outbreaks, there were animal deaths or illnesses preceding the human cases. So I started wondering, like, if these had been evaluated, if the water had been examined, could the human cases have been prevented? We'll never know. I mean, these could have been reported long after the human cases. I don't know those details, but it made me wonder. So we'll get back to that. Here are some of those potentially lethal scums near shore. The image on the left shows an active bloom. And I'd like to call your attention that even though it's very thick on shore, out in the open water, I'm not seeing that cyanobacteria green color. And sometimes blooms that are near the surface can be blown onto shore and create very risky conditions if the bloom is a toxic one. On the right-hand side, you see bloom material that's broken down over some days, and you see where blue-green algae gets its name. That is phycocyanin pigment you're seeing coming through now that the chlorophyll is faded. And scums are a real problem. Dogs are attracted to them. They're smelly. They're very appealing, apparently. But young children put everything in their mouths. And I'll always wonder if that's what happened here. There's a case report out of Argentina where a family went on holiday to the beaches in Uruguay. And this is just across the Rio La Plata River from Argentina. And the Rio La Plata has a history of blooming. And you should know it is a known phenomenon that rivers can bloom and the cyanobacteria and the toxins flow out into the coastal environment and can contaminate nearshore coastal waters and the organisms that live there. So after the family had their day at the beach, they all became ill. The adults recovered, but the 20-month-old child was so sick, she experienced liver failure and had to have a liver transplant. The explanted liver did yield microcystins. So after that 2009 to 10 cycle where there were 11 outbreaks associated with cyanobacteria, hearing more and more about dog events, more anecdotes about human health risks, the National Outbreak Reporting System developed another module, One Health and Harmful Algal Bloom Surveillance System. And it collects reports from voluntary reports from all states, territories. Any state or territory can participate. I strongly encourage you to do so. This is such a great system. And they collect reports of human illness, animal illness, and actual occurrence of algal blooms, both in freshwater and marine systems. This is the first report out of the system. It started in mid-2016, so this 2.5 years of surveillance. There were 18 states reporting 421 blooms, the majority in freshwater, and the majority of human exposures occurred at public outdoor areas. Of 389 illnesses where we knew gender and age, about half were female and 40% were children. And interestingly, there was a large bloom where almost 200 illnesses were associated with that single event. Here's the most commonly to least commonly reported effects. Again, gastrointestinal effects are number one, but then non-specific skin effects, ear, nose, and throat, and lastly, nervous system from this group of reports. And you should know that the effects were not categorized exactly the same way, so that you can't directly compare to the earlier reports and say, oh, these are different. Maybe not. Most commonly to least commonly reported toxins, again, microcystins lead, and you can read the rest. Nodularin, I hadn't talked about this before. It's a liver toxin similar to microcystins. Some of the rapid tests will detect both of them. Nodularin favors brackish waters, so it's less commonly found. So getting back to the animal illnesses and deaths that preceded the human outbreaks back in 2009 to 10. I worked with Val Beasley of the Pennsylvania State University, to review reports where both humans and animals had been exposed to cyanobacteria. We restricted those reports to where animal illnesses or deaths were potentially associated with human exposures, because we didn't want to just grab wildlife reports in these remote lakes or livestock deaths where there were no people around the lakes. We wanted bodies of water where people were interacting, using them for drinking water, recreating. Of 29 reports, we found 18 where the animal illnesses or deaths preceded human health risks or were used as sentinel events, and it warned of human health risks. Now, remember, I was talking about cyanobacteria as a really multidisciplinary issue that benefits from a One Health approach. We came up with this schematic just to show all the different layers, all the different groups that have to be involved for communication and action regarding a harmful cyanobacteria bloom with human or animal effects. And the primary reporters are anywhere from people who got sick after playing in the water to water managers out on the lake noticing a fish kill. So it's not one size fits all. But the takeaway I want you to know from this is we discovered where people effectively used these animal events to close lakes or to warn people of the risk of the water were in small jurisdictions. They're in tiny little towns or counties or political jurisdictions where professionals talk to each other across their topical areas. So the veterinarian may work with the local game warden. The physicians talk with the laboratorians at the public health lab. In the larger political entities, people tend to talk to each other within their topical silos. So I want to urge you, if you're working in the field of cyanobacteria in any way, make those connections on purpose with people in other groups so that you already have each other's numbers, emails, ways to communicate. If things start happening fast, you can work together to address them. Now, I regret to inform you there's an emerging phenomenon. It's been around forever. We're just learning about it, is what I mean by emerging. They're potentially lethal cyanobacteria toxins without apparent planktonic blooms, called benthic cyanobacteria. These are colonies, masses, accumulations of cyanobacteria that adhere to the benthos. So the bottom of rivers, lakes, they can adhere to plant material, rocks, to branches dipping into the water, wherever there's a stable surface. And these can occur in nutrient-poor oligotrophic systems. And here are some pictures of different types. And so their appearance is varied. And they will generally stay attached to the bottom, but as they die and break down, they can float as mats on the top of the water. So you may see that as well. And they produce potent toxins, and they're found all over the world. And this is a great review article. I'd like to call this out. It's worth evaluating. Susie Wood, who wrote this, was a pioneer in New Zealand in evaluating these benthic cyanobacteria accumulations that were really associated with a lot of dog deaths in New Zealand, anatoxins, saxitoxins. And I'd like to point out also, these benthic accumulations may not actively be releasing toxin into the water where it's a concern unless they're disturbed. So if they're being crushed by feet, if they're being torn up by boat hulls, if a big rush of water scrubs the bottom of that river and scrubs off the benthic mats, they can release toxin into the water. And so to know the risk associated with the bloom, there really has to be, or it's not a bloom, excuse me, with the accumulations, there really has to be active monitoring. And you can see this child playing with some benthic cyanobacteria. So that person's already getting dermal exposure. So what about signage? Do they work? Sometimes, like, somebody has to really want to read it and then to heed it. And you can see I pulled these from, here's some Wisconsin, King County in Washington, Cornell, and here in King County, they translated the information into many local languages, many different formats. Does everyone pay attention to these? Do they stay out of the water? No. And I attended a seminar a couple of weeks ago where a California official was talking about the challenge with signage at these benthic accumulations. If they leave the signs up all the time, people just start to disregard them. But if you're only going to post the signs when there's active toxin in the water, hazardous concentrations, that takes a lot of people power. So it's a real issue. So there are detection challenges with cyanobacteria blooms and mats. We all have limited resources. It's challenging. Habs are not always apparent. Even the planktonic blooms can rise and fall in the water column. You may not know it's there until it rises and then it's blown on the beach. And these are variable. They can change their cell densities, their toxin concentrations over hours. So if you have an outbreak and you go back the next day and evaluate the water, and the next day, I know that's very optimistic, but if you go back the next day and evaluate the water, it's not the same water that people were exposed to. EPA's developed a mobile application that can be downloaded onto people's phones when they go and recreate at these big lakes that are resolvable with satellite data. They can see the orange or red areas are cyanobacteria blooms, the greens, not apparent cyanobacteria blooms from the surface. So it's helpful, and it's helpful for organizations who are trying to allocate their resources. You can see a bloom forming maybe in the middle of the lake and be aware if the weather changes, oh, that's going to blow onto the largest beach in the area. So it is very helpful. I mentioned the diagnostic challenges, the issue of it being a diagnosis of last resort. There's also a lack of provider awareness. If a mom brings her baby in or young child in after a day at the beach, and the child has a fever and rash and vomiting, they're not going to necessarily think of cyanobacteria. That could be a viral illness. These are very non-specific health effects, and we don't have diagnostic tools. Also, people are exposed to mixtures, so people have very different presentations after exposure. There are assays in development. CDC developed this microcystin and nodularin assay for human urine. It measures protein phosphatase inhibition. So it doesn't measure the actual toxins, but it measures the effect of the toxins. This has not been commercialized yet to the best of my knowledge, but I believe it's in the process, and there are many people looking forward to assays such as this to get in the hands of healthcare providers. I'd like to give you the URL for OHABs and a contact email, and I urge you to join the community of practice. It is a very collegial, large group where people share their experiences, their approaches, their practices, successes and failures with cyanobacteria blooms, human and animal effects. People learn from each other, and that's the stage where we're at. We are all learning from each other because this is really an emerging, complicated issue. And here's a CDC toolkit for disease outbreak investigation and page 30 discusses investigating harmful algal blooms. So awareness of cyanobacteria and health risks are still low, but do appear to be increasing. And especially these dog deaths, I'm not sure how much human health risks are increasing. We do know that animal illnesses and deaths can inform human health risks. Wildlife especially are the first ones out there, and paying attention to wildlife deaths might prevent some human illness. Recreational venues are the most common site of exposure, and there are multiple routes of exposure. People are exposed dermally, can ingest the water, and there's potentially aerosol exposure. And there are multiple non-specific health effects. One of the diagnostic clues is that onset of illness may be rapid. There's a report from the 1930s where a physician was gazing at a cyanobacteria bloom from a dock, and I guess he slipped and fell in. He developed a rash while he was in the water before he could scramble out. And many of the outbreaks in the surveillance, the NORS system, show that onset of illness can occur within 24 hours after exposure, which is a great diagnostic clue because there are very few pathogens that do that. Children are more likely to become ill. I already mentioned that they're more likely to ingest water. And you saw the child picking some up. I don't know, benthic cyanobacteria fights. I mean, I could absolutely imagine that. And cyanobacteria communities are the ambient exposures. So I want to make it clear that when you see an assemblage of cyanobacteria, it's not a pure culture. There's mixtures of phytoplankton, there's zooplankton feeding on it, there's other microbes. Colonies of cyanobacteria create biofilms that support many other kinds of microbes, bacteria, protozoa, and there are mixtures of toxins. So why is it so hard to pin down a definition for harmful algal bloom associated illness? Because it is not one thing. It is not one thing. It is different among exposures. That's something that makes it extremely challenging. And some more resources. EPA has specific general HAB information, specific cyanobacteria information, CDC's HAB information, and NOAA's HAB information. And NOAA monitors the Great Lakes and coastal areas. Excuse me. I was asked to speak about sargassum, so I included this slide, but I am not an expert. I took this information from Florida Department of Health fact sheet, and the URL is there. But just in general, these are not cyanobacteria, they are macroalgae. These are eukaryotic organisms. We call macroalgae seaweed. There are many different kinds. Sargassum makes these huge blooms in the Gulf Stream area. This pelagic accumulation is a wonderful habitat for wildlife. It's very important, but sometimes it's blown on shore and it can create a nuisance as it rots on shore, releases hydrogen sulfide, causes respiratory irritation and symptoms. And recently, Florida Atlantic University released a paper about describing molecular evidence of vibrios, including Vibrio vulnificus, in the sargassum. And so just to throw it out there, there may be potential source of other exposures. Again, an emerging issue. I'd like to acknowledge my collaborators at Pennsylvania State University and the CDC. And here's my contact information, and I welcome questions. Thank you for your attention.
Dr. Hilborn, this has been the most informative webinar. You've just done an amazing job. Thank you very much. We have a few questions. The first one that came in was at the beginning of your presentation. And the question is, what is meant By untreated drinking water, are you referring to well water?
Good question. So cyanobacteria in general requires sunlight to live. It's a photosynthetic organism. In general, well water is not affected unless it's under the influence of surface water in some way. So springs where you think they may be groundwater, but they're actually some surface water mixed in, may be at risk. When I say untreated drinking water, I'm really talking about this special situation where people are taking surface water and using it for domestic use, whether it's irrigation, cooking, showering. And that's why I called out these lakeside cottages. They were built 100 years ago, and that practice was common. And I do know that people are still doing this today. So it's just something to be aware of, but it's not the majority of the population. Treated drinking water is the norm, or well water, groundwater.
Thank you. And how do people know when there is a bloom or the possibility of a bloom? If you're going to take your dog just for a weekend hike and you come upon a creek, what's the best way to know? Is it the blue-green, or can it be underneath, like you said?
Well, 7 years ago, if you'd asked me that, I'd say, well, look for a paint-like accumulation or colored water, or if you wade in the water up to your knees and you can't see your feet, that's a bloom, don't go in the water. But now we have benthic cyanobacteria. I'm aware of it. More and more people are becoming aware of it. Jurisdictions are actively monitoring this. And I don't know what to say. I don't know how the average person can differentiate harmless aquatic life from benthic cyanobacteria or other blooms. I don't know what to say. I will tell you, when I go hiking with my dog, I bring their drinking water and I don't let them in the water. And I know that's probably extreme, but I'm a cautious person by nature. So that's me.
You're a scientist, and this is your field of study for 25 years. The next question I have is, if the water looks fine, but there's green stuff on the bottom, is that just algae, or is it going to be harmful algae?
I don't know.
And that's where your advice is, just don't go in.
It's awful. I don't have the tools to tell people. Like, people love to go, I love to go hiking with my dog. It's awful, this situation. And I'm sorry, I really don't know how to guide people right now. So many jurisdictions are on top of this, and at popular beaches that are designated recreation areas, there may be monitoring. And if that's the case, like, reach out to your state and local folks and talk with them, coordinate with them, say, hey, do you have any blooms going on? Is this something you monitor for? Some places have hotlines to report if you see green stuff. Say, hey, I was at Jones Lake, it's green, what is that? Maybe that can bring people out there. But if you're just walking off out in a park that isn't water body, not meant for recreation, or out on kind of wilderness type trails, I don't know how you would know unless you know how to identify it. And I don't know how to identify it. And I've been working in this area. I mean, microscopes really help and training.
And that leads into my next question. How do you know if you have a bloom-associated illness? How does it appear in animals versus what we went through with how it appears in humans?
Yeah. So animals can have vomiting, diarrhea, trembling. At higher doses, I mentioned the convulsions. if an animal's been recreating in water and is not acting right, it's time to consult a veterinarian and tell them, we were in the water. Could this be associated with that water? I'm worried about harmful algal blooms. Not every care provider, physician, or veterinarian is aware of this as an issue. But if the client or patient or parent of the patient brings it up, at least it's on the radar then.
Okay, that is about all the time we have today. We have one more question that just came in. What tools should a local public health agency have on hand to be able to properly respond to communities' concerns?
That's a question. It's a great question, and it's probably beyond the scope of my ability to answer it knowledgeably, since I'm sitting at a different level. Like, I haven't been faced with this and developed the checklist, but I really encourage you to join the community of practice and to learn from your peers, because I am not the one having to go out and say, all right, we need to stock kits for toxins. We need to get someone knowledgeable in microscopy to decide if we have an algal bloom here. I also will mention we have a wonderful scientist in our Region 1, Hilary Snook, who has developed a citizen science program for how to recognize and identify cyanobacteria. And he's worked on this for many years, and he's a great resource. And I'll make sure that his email is also in the chat. If you want to develop your local expertise or have maybe lake associations or groups of citizen scientists, people who live along these water bodies are highly motivated and may be interested in this type of thing. So,
as we run out of time, I'm going to throw one more quick question at you. This is how much work is being done to provide more education to the veterinarians?
there are a lot of efforts. I know multiple states have developed veterinary education materials and have educated local or sent them out to local veterinarians. And again, the community of practice, sharing resources is common. You don't have to invent the wheel yourselves. Everybody is in there fighting to understand, fighting to characterize, working towards what are the best solutions. And of course, it differs among areas, but there are always takeaways and lessons learned that you can apply to your specific area.
Again, Dr. Hilborn, thank you so very much. We also want everyone to know we've gotten questions. They would like to share this webinar with their staffs and other members of their agency. It will be uploaded on the NEHA YouTube channel the beginning of next week, so you can share that with people. And your feedback to us is extremely important. So if you would please take a few minutes to fill out the survey of what you have learned in this webinar. We will use that to continue NEHA's mission to build, sustain, and empower an effective environmental health workforce. And again, Dr. Hilborn, we cannot thank you enough for sharing your expertise with us. And I will practice on trying to say those scientific terms, but no guarantees there. And so everyone, thank you very much for spending a 1 hour with us today to learn about this important topic.